It's 6 o'clock, so we'll do this in good standing of following our normal meetings and get started on time. And anyone who struggles in, we'll just either mock them or let them join. Your guys' choice. I'm Amy Bowles. I'm the Public Health Director for Beltrami County. I've also been appointed as our Chief Strategist for the Opioid Steering Committee. And my co-chair is Ann Linseth, the Director of Health and Human Services. We really want to thank you, first of all, for coming this evening. We know that days get long, and especially when you've been at work all day or just when the evenings start getting dark really fast. And so, as many of you know, the state does ask us to host once a year a community session where we invite municipalities and our community partners. And this year we've kind of changed it up a little bit. We've had 2 rounds of RFPs go out. So that's requests for funding would be a better word to use, but it's requests for proposals. And that was where people write in and they say, hey, we'd like to use some of the opiate money. Here's how we're going to use it. And so you're going to have some individuals speaking on behalf of how they've been using the funding. And we have a real treat tonight. We have our Youth Advisory Committee. We have some representation from them. And so how exciting is that to get to hear from our youth? That's the voice of our future, right? Like, I'm guessing that's why you guys all came. Yeah, me too. And then not to forget to mention, but we have Jeremy Drucker and Jennifer Blanchard from the state here to learn and just to share very briefly about their department and what they do at the state level. So I'm going to get us kicked off and try and stick to our agenda. I just want to begin with giving the community an update on what we've been doing as an opioid steering committee. And so if you're not aware, on the county's website, under public health, there is a specific tab that's designated for our opioid steering committee work. We have resources in there across the state. We have resources in there that serve our community. And then we keep all of our presentations, all of our documents, and all of our meeting agendas on there. So the very information that I'm going to be sharing with you during the update session and during what's to come, you'll find that online on our website. So just some of the things that we've been up to is when we began, we decided that it would be really useful to set ourselves up with a rhythm and a budget. And so we did that in 2 ways. We looked at how much money the county is supposed to, right? Because it's a lawsuit settlement, so we're not guaranteed these dollars. But if everybody pays into the settlement, the monies that they're in a sense being charged with, right? Then we are supposed to get about $2.8 million over the course of 18 years. That's 18 years, that's $140,000 approximately, give or take, over the course of 18 years every year. And so we said, why not set ourselves a budget to get us started? And so every year we spend about $140,000 within our community. So some of that goes to support our reset program, and some of that goes to support the different agencies that you'll hear from tonight. And some of that goes to support the advertising and the administration work that goes into managing those dollars. And that's just a real high overview. You'll see online, you can find more information about how those specific dollars have been spent. In addition, we also include an update in the Beltrami County newsletter. So that's put out quarterly, which you can sign up for on the county website. So you get a copy of that sent to your email every month. If you sign up to that, if you don't know how to do that, you can talk to Diane, but not tonight, maybe tomorrow, because she's also had a very long day. And so in Q1 of 2025, you'll see our most recent update in there. I'm not going to read all of those details to you, but rather I'm going to just give you some high level information on the things that we've been up to. So in addition to setting a budget, we've also released 8 RFPs into the community. So that means that 8 organizations, and some of them are repeats. They've applied the first year and they had a good application and scored high the second year, so they got additional funding. But we've released 8 different contracts out into the community to ensure that the opiate dollars are going to serve the people of our community, and they're also supporting agencies that are already doing really good work. We've also launched our Funding Hope campaign. And so last year when we called this meeting, one of our biggest takeaways as a steering committee was, how can we help people who are struggling with addiction? How can we help people that are at risk for substance use if they don't have hope? And so we soft launched our Funding Hope campaign. And so every fall, right now we're planning on releasing money into the community that doesn't have to go through a strict RFP process or a scoring criteria. So Reed, can I point out you? So if Reed comes to me and Rita oversees the Nameless Coalition, and he says, hey, Amy, I really could use, 10 pair of boots, 5 jackets, and 100 hats to serve the people that I work with. And 90% of the people that I work with struggle with addiction or are at risk for substance use. I can say to him, you meet the rules of the MOU that the state set forth for us, make that purchase, send me the receipt, and I'll cut him a check for that money. And that is a way in which we feel that we can give hope to people, that Reed then and his team have an opportunity to connect with the community, help connect with the people that they're serving, and give them hope. And if we can give hope to people, just maybe they'll consider wanting to connect with someone to get additional resources, maybe to get into treatment, maybe to extend that treatment into long-term recovery. And so it seems like a small thing and something that you maybe can't measure on a grand scale, but even if we make a difference in one person's life, the Opioid Steering Committee said we're on board. That's what we want to do. Another thing that we've done is we've tried to do a really good job of communicating with the community through the website. So take a look, see what you can find on our website. And if you're not finding it user-friendly, or for information where you're like, I'm not really finding this, reach out to me and I'll definitely help you navigate it and find the resources that you're looking for. The next thing that we did is we after forming the first committee for the Opioid Steering Committee, we recognized that some people are just too busy. Some people want to give up their seat and they want to have another person sit in their place to be able to be a voice at the table. And so we've had 4 or 5 members drop off over the course of the last 2 years. And so we did release application, simple 5 questions. And so our committee will be meeting next month to review those applications to add additional members to the steering committee. One of the things that I'm most proud of that steering committee is we have a very diverse group. We have people from different backgrounds as far as life experiences, different walks of life. People who are concerned about their family members or their neighbors, or people who work with substance use, recovery, and addiction in their everyday life of work, right? And so I really think that we've done a great job of having all voices at the table. And even if you're not on that committee, it's really important to know that your voice is still important. So whether you want to attend our annual meeting like this, or you want to send us an email and say, hey, I have some questions for the committee, could you bring these things up? We're definitely open to hearing new ideas, old ideas, and getting your community feedback. With that, I'm going to introduce our next speakers. Are you ready? All right, come on up. So let's welcome our Youth Advisory Committee, and I am going to have them introduce themselves.
Hello, everyone. My name is Cami Kelm, and I work with Beltrami County Public Health. And part of my role with public health has been to help implement this Youth Advisory Committee. So thank you for letting us come and speak with you this evening. In my work with the county over the years, a lot of my career has focused on substance use intervention and prevention. And I've watched a lot of the changes over the course of time and in our community. And as you know, substance use continues to be a pervasive problem. One of the areas that I feel strongly that we can do something about it is in our youth populations. And so it was exciting to me to be able to coordinate with VASC, and I'll let Brianna introduce herself here in just a moment too. But one of the things that we did was we started to talk about how do we approach the youth? How do we get them involved? And through conversations with Basque, we decided that to utilize the grant that we received for the cannabis use prevention to focus on vaping and THC use in the community. And so we did a survey in the schools last spring, and one of the things that we learned through those surveys was that a lot of youth are vaping, and they know people who vape. And so that is definitely an issue within our community. An overwhelming number of students gave the reason that they do so is stress. And so I'm going to turn it over to Brianna because she works in the schools, and we'll do some additional introductions here as we go.
All right. Hi, I'm Brianna Schroeder and I work for Basque. I'm the intervention program specialist and I also run the juvenile diversion program for the county. I am out at Bemidji High School 3 days a week and helping work through some behaviors and things that pop up. And the number one thing that we see a lot of is vaping. And that is like one of our number one write-ups that we have. By the end of a school year, we can have a couple 5-gallon buckets of vapes that we have confiscated. And so, you know, we're trying to get away from this is a behavior problem to this is an addiction and substance abuse problem. And how are we gonna, where can we put the supports? How can we make it comfortable for the youth to reach out to somebody to get those supports, to get the help that they need? So I have a lot of conversations with teenagers every day about, hey, you know, why'd you have the vape? What caused you to go into that bathroom with your 5 friends and do that? But also, you know, the dangers of it, because a lot of these kids obviously are not old enough to be purchasing these in a gas station or smoke shop. So they're getting them in places that they truly don't know what's completely in these vapes. And we are seeing the consequences of that. So I'm very excited to be working with these guys and happy that we've got our youth here to do this. They're a little nervous, but we promised them that you guys are a great group. So we'll introduce these two. So we've got Avery Capella and Sydney Baizzi, and I will pass this on to these guys.
So before we get started, like obviously these guys are the stars of the show here, and I am so proud of these guys for coming out and being willing to talk to everybody. So we're just going to ask them some questions and ask that they answer the questions and kind of do that format. So can you guys tell us, why did you choose to join the substance use prevention? Why did you choose to join Rise Above?
I wanted to help educate teens about what they're doing to their bodies, help better mental health, and then let teens know that there's resources out there to help them quit.
I joined from the perspective of someone who's been an athlete my entire life. I wanted to be the voice for the athletes who are struggling with their mental health and they look to substances as their way of coping. I just want them to know that they're seen and there's other ways to deal with that.
Can you each talk about what we've done so far, or what you've done so far in as part of the Youth Advisory Committee? Like what did we do over the summer?
Oh, okay. This summer we started the group at the end of the school year last and met a couple times over the summer to help get the program started so it was ready to start doing stuff right when school started this year.
So one of the first things that we did was talk about a name and what we wanted our logo to be. And we chose Rise Above to remind kids that they are stronger than their challenges and they can rise above their addictions. And then we chose the mountain as a symbol of empowerment or encouragement.
And you'll see their logo here on their t-shirts.
And then also over the summer, we went on a field trip to multiple different gas stations to see what was available for teens. And all the gas stations but one had something at it, whether it was vapes, kratom, or other nicotine products. And we learned how very easily accessible everything is to teens.
Another thing that we did was we went to some of the first volleyball games, football games, swimming meets, just things like that. And we use the activities as an opportunity to kind of get ourselves out there and start connecting with the community, like in the early stages of our program.
How about, can you guys talk a little bit about, you touched on the logo and you've created, what else have you created from?
So we have a mascot. It's a raccoon. His name is Randy.
We have him on tonight.
Yeah. And we are eventually going to create an Instagram page with him, and we're gonna like post him at different spots around town and say, come visit Randy, and then like the first however many people get there to see Randy and see all of our stuff that we have, will get some sort of prize of some sort.
So going along with the prizes, we also did a Jeopardy, and then we have like a big spinny wheel. And we're gonna use those at games and some winter activities and then like conferences and stuff. As another way to like reach out with those kids, and we have some personalized prizes. We have little frisbees, bracelets, stickers, and then some stress balls. And it's just like a good way to get kids, like an initiative to get kids up and learning and coming to us.
Can you guys, did I miss anything?
I don't
I don't,
know.
I don't think so.
Okay, can you guys talk about, have you learned anything through what we've been doing here?
I've learned about Kratom. I had no idea what that was before we started this group. And how bad the effects are from it. And then I also learned that from a lot of research of creating different things, that a lot of teens want to quit, but don't know how and don't know where to go to get the support and the help they need.
Yeah, so I also learned about kratom and like the effects that it has on the body, and I was just really like shocked to see how like easily accessible something so harmful was to your body. It's called gas station heroin, and it's just like sitting there and you can just get it, and that's just like crazy to me that you can just go in and buy something like that. Um, and then I also learned like there's a study out that nicotine actually makes people feel worse. And all these kids are going to do it to feel better, but it's just that's what's getting them hooked. So
Okay. Do you guys, what's your vision for this group? What,
I want to see this group become more well-known in all throughout the community. And then I also want more people to join our group.
yeah, I want our program to become known, or like larger, like Hey Norm kind of. That's a big one. And just let kids know that we're here, the ones that are ready to quit and the ones who aren't ready yet but still want that information ready for them.
anything? Did we miss anything?
I don't think so.
How many members do we have?
5.
We have 5
5.
members. They're from Bemidji High School. We do have one from Black Duck High School right now.
Mhm.
We're just kind of trying to get our feet underneath ourselves as we keep building so that we can build out into the community. Like these girls said, we want to get into the charter schools and the other schools in the county.
Another big part of our program is, Brianna has helped us get involved with Indian education, and, I go in that office and I see they have the stickers and stuff out, so it helps us to learn like about what do they use in their spiritual beliefs, the tobacco and stuff like that, so.
Yeah, that's a huge part.
Yeah.
Yeah.
Yeah, and I would just, I mean, these guys are doing such a phenomenal job. I am so proud of them and the work that they've put in so far, um, and they're go-getters, and they're willing to, you know, it's all youth-led, and it is youth-created. Everything that they have done has been their ideas. And so that's the really cool thing, is we're talking about hope, you know? And I truly believe that the youth are the hope, right? And, they can do a lot, and they are doing a lot. So it's been fun to be a part of that. So.
Do you guys have any questions for our team? Yeah. Grab some of our stuff, you guys. You guys are so brave. That's so exciting. And just so you know, you can go back and watch yourself because we are recording this, so. We didn't tell them up front. You can share it. So the next part of our presentation tonight is giving our community an opportunity to hear from our RFP awardees. So I'm just going to be calling up our different awardees that happen to be here tonight. And so Reed, I see you sitting there, and since I've already picked on you once, do you want to come forward? And let's see, Dave, do you guys want to go next? There you guys.
Hi there. I'm Reed Olson. I'm the Executive Director of the Nameless Coalition for the Homeless. We operate 2 shelters in Bemidji. One is called the Wolf Shelter, which is just right over here on 6th and America. That is an overnight emergency shelter. It's got 24 beds. And then we also operate our day shelter, which is the old Upper Mississippi Mental Health Center on 15th Street and Delton. So I'm just going to basically answer the 4 questions that you get, right? So how have I used the funds? We haven't received any of the funds yet, so I haven't used any of it. We have spent the money that we hope to be reimbursed for. So we intend to use the funding basically to support our operations. We're not doing any new activities with the funding, but it is helping us in a time when we're seeing other funding sources dry up. It is really helping us maintain our staffing levels so that we can continue to have a safe environment at both of our shelters. We do a lot of harm reduction. Not everybody is impressed with harm reduction, but the best thing that I can say to people that don't believe in it, and there are a lot of people that don't believe in harm reduction tools, what we're able to do is keep people alive without the harm reduction, without Narcan, without fentanyl test strips. We're going to see a lot more deaths in our community, and someone that is dead cannot recover, you know. So we try to give people the tools that they need to be able to survive. And like Amy had said earlier, give people hope, give people a little bit of dignity, a little bit of respect, a safe place to be, and hope that they can slowly come around. I can say in the last 3 months, now we see in the third quarter, we saw about 259 unique individuals come through our doors. Of those, we know for sure, one of the problems, we aren't caseworkers ourselves, so we don't always know what happens to people, but we know for sure that about 5 or 6 people found housing and about as many people found their way into treatment. And so for us, that's a pretty good success rate. That's what we want to do. We want to get people to stability. So these funds help us do that. Barriers with funding, with the funding or without the funding. The one thing, this maybe isn't germane to addiction and substance use disorder, but one of the things that we specifically are seeing a lot at our shelter that is very challenging for us is a growing amount of people that have persistent and untreated mental health illnesses, especially schizophrenia, but other illnesses like that that really affect someone's ability to engage with society, really high levels of paranoia and institutional distrust. We have a heck of a hard time getting people to what we feel is a better space, whether that's civil commitment or something like that, or some kind of treatment. And so people languish with us. And they We love them, so don't misunderstand me. We love them and we want to help them as much as we can, but we don't have, neither me nor any of my employees have letters behind their names. We're not doctors, we're not nurses, we're not psychiatrists. You know, we do not have the capacity to help people with such profound problems. And so when we're spending a lot of time working with them, then it inhibits us from being able to really focus on our greater mission. You know, and in this day and age of seeing federal funding being cut, everybody has to be a utilitarian kind of. You want to do the most good for the most people. And unfortunately, this small subset is impacting our ability to serve the whole. So that is the successes. I guess I'll just point to the people that we got to treatment. And I think anecdotally, we can say that since we have opened our doors, our overnight shelter especially, we're coming on, we will be, the Wolf Shelter will celebrate its 10th anniversary on February 16th. And in these last 10 years, I think you can ask law enforcement, you can ask the Sanford Health, and you can ask the families of Beltrami County. We have really stopped preventable deaths in our community. I think there's no doubt. I mean, it's hard to prove a negative, but we know that before the wolf was here, we were seeing 3 to 5 people die a year of exposure, and now we don't. Does that mean that nobody dies? Yes, we still have deaths that are really unfortunate, but they are so much fewer than what they were before. And some of our successes are the fact that someone passes away in a nursing home, in an assisted living facility with their family and not on the streets. So we judge success a little bit differently maybe than other people do, but we are really there helping the most vulnerable people in our community. And I'm just so thankful to the opioid steering committee and the county board for approving the funds to us, because it really is instrumental. It really is, it is ensuring our ability to continue to operate and save lives and move people into better situations. So thank you very much.
Hey there, I'm Dave Erickson with Stellar Human Services and the Stellar Program for Recovery, which is new to Stellar. So we want to also say thanks to the community, to the county board for the funding. Without that, I would not have this gentleman standing next to me. So he's a great, I'm going to try and talk fast so you can hear a little bit about what he does. He's Benji and he does transportation and peer support. He's a peer support specialist as well, and just does many great things. So as far as what we've used the funding for, likewise, harm reduction is kind of a new thing to the program for recovery. We've trained some people in that and got some curriculum. So it's a new thing. We're excited about it. And essentially, like Reed said, it's about meeting people where they're at and asking about what they need. So that's been good. Transportation, I'll let Benji talk a little bit about that. Substance use assessments, we've done, in the last 2 quarters, we've done 30, probably about 40 to 45 in 2025 for people that don't have funding for it. It's been great. It's great use. Barriers, well, you know, a lot of them, there's financial barriers, that's a big issue. The funding for the programs, transportation, I think, is a huge issue for folks trying to get to and from places. And Benji's been incredible with that, a great help, but I think the community could use a lot more. We're working on it. Peer support that Benji does, and other housing is a huge barrier, and we wish we had answers to that issue, but it's something that we all continue to work on. Successes, I think Benji is our biggest success. Having him here and doing the things he does. You talked about the little things, and it's conversations that I think you have when you're in the car with folks, getting people to appointments, helping them get their driver's licenses. It's a big deal. And then just creating collaborative relationships. We've done, Benji and Terry from the program have done a lot of outreach over the last year, worked with many different agencies. And so just, I think building those relationships helps us provide better services and helps us connect with people more often. I'll let Benji talk a little bit about what he does.
All
if
right.
That's okay.
All right. I'm Benji Whaley. I just want to let you know that where I come from is I've had decades of addiction, decades of homelessness, decades of jail, prison, being hungry. And I have, through resources in the community, I've overcome all of these barriers. And so as a peer support, my job, the honored to be in this guy's presence here, is they allow me to come alongside people and to bring, since I'm familiar with the resources that have brought me out of my addiction and out of my challenges and my barriers, I know the path that got me. So coming along, being peer support means coming alongside these people, bringing them to the places they need to be to overcome the same barriers that I have. So I'm intimately familiar with the barriers. So, and one of the greatest things that the transportation issue, it's not just transportation for the clients at Stellar. We're also transporting people from, from their homes to inpatient treatment and stuff like that. Also, I just want to let you know that some of the outreach I do, funded by the grant funding, I get to go to the homeless day center and I get to do outreach. I get there for an hour a week. Just today, a gentleman came from the shelter that Reed provides. He came, he did an assessment, and he is now in services at Stellar Program for Recovery. So in tandem with Reed, we are helping people. So it's just an amazing thing to be able to have the funds. Just to let everyone know, everything you guys do matters. It really does. And I'm proof of that. So thank you. Oh, yeah.
Hello, I'm Lindsay Pryor. I'm the Executive Director of the Village of Hope, our family homeless shelter in Bemidji. We had received the round one of funding. The funding, first of all, thank you. But the funding went to training staff in some of the practices we use to prevent misuse of substance abuse and harm reduction. And so we train staff in motivational interviewing and trauma-informed practices. The barriers, housing, I'm going to say that, of course. And then transportation is a huge barrier. I want to give a shout out to Benji on that because one of the successes that we've had is collaborations within the community, being able to use some of this funding to work with these agencies like Nameless Coalition and Stellar. With transportation being such a barrier, like I know there were several times that Benji was right out on the road waiting for, one of our people to come out to get them to where they needed to go. Otherwise, they might not have made it to where they needed to go, And so that's probably one of our biggest successes, I would say, with this funding is those wraparound services that we've been able to provide to prevent that misuse. And then as well as if people want, we meet people where they're at and we use strength-based approaches, working on their goals. And with that, if with the training we were able to give to our staff, then they'll be able to know the signs of if be able to know the signs, like if there is a overdose, and then we have those harm reduction supplies and those types of things. And then also being able to meet them where they're at and support them. One more success I would say is we've been able, with the funding, we were able to do follow-up case management after they left us, because a lot of times we only have families for 60 days and that's a very short amount of time. And within building those relationships, that follow-up case management, just to have somebody to, say you're having a bad day too, now that they're not with us and in that in that environment where where everybody is sober, that and now they're out in the real world, that they're able to maybe fall back on somebody or reach out to one of us to get that support. So, yes, thank you.
I think that was all our community partners awardees that were able to, oh, yes, come on. Yes, I'm sorry. I forgot that yes. Yes. From North Homes. I'm sorry. Melissa had said
Yeah.
that she couldn't make it, so.
So, yeah, so I'm,
Thank you.
I'm here representing tonight on short notice, so bear with me. My name's Matt Leapis, I'm from North Homes, and we've used the grant to do a number of different things. One, direct client assistance, driver's license reinstatement, same with the screenings, the assessments that people can't afford, we've been able to do that. Community engagement and recovery events, we just recently had a punk show in town, which was the second annual, so that was, but we're trying to get things going in town to actually do, get out and do things. We had Community Colors, a family tie-dye event. Peer recovery, we, allowing transportation and getting people to, we've been doing gym memberships and going to the gym with them and starting healthy routines. The big one for me, games and group activities. We've adopted a mentality of doing fun together, not just talking about it. You talk about doing fun things all the time. You go to groups, do something fun. Well, let's do something fun. And so we've invested in some games and some group activities. Youth group initiatives, we've had guided art sessions, bowling outing, and we've collaborated with Evergreen to kind of that youth transition time. And looking ahead, we've just, this matrix model acquisition, evidence-based outpatient treatment programming from Hazelden, we're going to start incorporating that into our program, and harm reduction resources. So in a nutshell, that's a very brief overview of kind of what we've done, but that's all I got.
Thank you, Matt. Sorry about that. I even welcomed you, but I didn't ask if you were speaking on behalf of Melissa. So thank you. Another awardee was Face It Together, and they're in the process. They've just been awarded funding, so they haven't started spending their money yet. And then an update from our Minnesota drug addiction and drug court. They just wanted to let everybody know that they've been using the funding to help keep people in recovery. So they've been buying supplies to do testing with people who are in their program. And then our last awardee was the fire department, and they are purchasing training for all of their full-time fire department employees to get training on how to better respond to events that they're called to. And then it's kind of an in-depth training that it also teaches them more how to work with people when they are responding. And the plan is to do a train the trainer. So not only with their little over $4,000 will they train their entire team, but they'll train a trainer so then they can take that training into other fire departments across our county, and maybe even share that resource outside of the county. So that is kind of a summary of our where we've been, what we've done, and who has spent money, and our youth and what they're up to. And I believe next on the docket is our Jeremy and Jennifer from the state. All right.
Thanks, Amy, and thank you to the Beltrami community for having Jennifer and I up here. My name is Jeremy Drucker. I'm the director of the Office of Addiction and Recovery for the state of Minnesota. This is a relatively new role, but basically what we do is we chair what we call a subcabinet, which is a fancy word for a collection of state agencies that all touch on substance use disorders. So the way that state government works is, we have an issue area like health or human services or public safety or corrections. And then we have a state agency that addresses that topic. For big issues like homelessness or children or substance use disorder, oftentimes the governor and the legislature will create what we call these sub-cabinets that are a collection of all of those different agencies that address that big topic in one way, but may not be working together closely to make sure that those outcomes that we're doing everything we can and as coordinated and as aligned as we can to make real meaningful difference in people's lives. And so in 2022, the governor and the legislature created this sub-cabinet on opioid substance use and addiction. They created the addiction and recovery director position, which is mine. And so I'm the first in there, and I like to joke, the one thing they can never take away from me is that I was the first. But it's really been a great opportunity to see all the different ways that state agencies work on addressing substance use disorder, helping them work together, helping the corrections system and our prison folks work with our human services folks who are working with our public safety folks and then our Department of Health folks, and really think about what is it that we're trying to achieve at a big level in terms of outcomes, and how are each of the agencies that are working in this space really driving towards those outcomes that we're trying to achieve. So whether it's reduction in overdose deaths, whether it's creating a stronger public health infrastructure with more meaningful prevention opportunities for our kids, whether it's addressing unsheltered homelessness and substance use disorder, how are we all working together and what is our piece of that? Would also add that in part of that effort was the creation of a governor's advisory council on opioid substance use and addiction. Really grateful that Jeff Lind is on that governor's advisory council. He's just a great voice for counties, for Northwestern Minnesota, and just really brings just an invaluable perspective that the entire council really respects and admires and is really valuable there. Had a great day today. We were coming up and we got connected with Amy, who put together just a great day for Jennifer and I. We had a roundtable discussion this morning with Matt was there, and some other folks were there from the community to talk about our youth, talk about prevention efforts that we're doing and what are the struggles that some of our kids are facing and how can we come up with strategies from prevention, treatment, and recovery to really address those. And it was just amazing to hear the cool things that are going on in Beltrami and in Bemidji, but also the challenges that are being faced in the schools. And then I had the opportunity to speak to the county commissioners today and hear about some of the work that's going on here. And so it's really been delightful to be here and to hear now about the opioid settlement funds. We are very interested in my office with how counties are spending their opioid settlement funds. As I think many of you are aware, 25% of those funds go to the state, 75% go to counties and local government. And so that is a lot of coordination that needs to be done if we're going to really get the best and highest use out of those dollars. And so to hear about the things that you're all doing with those dollars is really great to hear, with the peer support, with transportation, with really using those to address the local needs of your community, because we know that every community is different. Minneapolis is different than Bemidji, and Rochester is different than Roseau, and Mankato is different than Duluth. And so making sure that there are funds available for local solutions to these local problems, but with those overall goals in mind that we're all trying to achieve is really an important thing. And so we're just delighted to be up here. We've had an amazing day, and just really excited to hear more from you in the next section in this roundtable conversation. And we're always happy to answer questions too if folks have them, on sort of how we operate at the state level. So thank you so much for having us, and we just really appreciate the hospitality.
Before we begin the roundtable discussion, I just want to do two housekeeping things. One, if you are a member of the Opiate Steering Committee, would you stand up and then just introduce yourself and your role in the community as far as your job or why you're on the committee? So, do you want to get us started, Anne?
I'm Carissa Golden. I'm the program manager for substance infection intake investigation, assessment, licensing, and our reset program.
I'm Joe Woodrow. I'm the recovery specialist for Santa Fe Health.
And I'm Mindy Groden. I'm a LABC and LPC therapist and substance use, and I'm the clinical lead over our recovery medicine clinic, which is the MOP program, and then also SUD in Bemidji, Catholic, and Park.
Thank you. And Jeff, before you and Carissa sit down, I'm going to put you on the spot. Oversight on my part, they oversee our reset program. I would be super embarrassed if I didn't give them the opportunity to share with the amazing things that they're doing with the Reset program.
Yeah.
Do you want to use the mic just so people are like? Thank you. I'm sorry for putting you on the spot. You're fine. Okay.
Very excited about the effectiveness of our Reset program. A number of people had a vision in Beltrami County many years ago about how can we help people who get into the jail, get out, go back to the jail, get out, people with a lot of strengths, with a lot of potential, and how can we help them break that pattern that they're in. It took a lot of work, but we got the program off the ground 4
years ago now.
4 years ago, and we found an amazing person to run the program. Her name is Amanda Sackow. She works in the jail 5 days a week. She builds relationships with people, and for those that make a commitment to some positive changes in her life, she provides case management to them when they leave the jail. She has done some amazing work with people, knowing that the people she works with are the ones that are ultimately doing the work. She's guiding them and supporting them. It's a successful program that we hope can grow in the future.
I just say that we did work, we spent a lot of years trying to find a way to develop a program. We went to a number of different places. One of the places we went to was down in Blue Earth County, and went to I think the yellow ribbon program that they put together down there. So we didn't exactly copy it, but that was sort of the blueprint for the work that we put together. The beauty of this program is we actually found the right person to do it. You know, with so many of the programs we have out there, anybody can step up and do work, right? Anybody can step in and do things. But there's only so many people that can actually, that truly care about the people that they're working with and truly care about finding successes for people. And when you find those people, the people they're working with know that someone really cares about them and finding the successes they have. Amanda is the star of the show, and it has far exceeded any of our expectations. So she's the one that would deserve any applause, and she is just an incredible value for this community and to the people that she works with.
And now for our roundtable. So this is just an opportunity for community members to ask questions of the Opioid Steering Committee or give us your input, share feedback on ways that you think that we should be using the money or struggles that you're seeing in our community. So Ann Linseth has a mic, and we learned last year that if we didn't mic people, the people online couldn't hear the questions. So if you just want to stand up, Ann will come around to you and give you the mic, or you can raise your hand if you don't want to stand. So this is your time, community.
Have Mike, will travel. To fill time, since no one's wanting to speak yet, I will talk a little bit more about Reset, and then I will bring this to Reed. We do support a portion of the administration of the Reset program through opioid steering settlement funds. We also braid funding together to support that staffing for Reset. But I think a really important piece to highlight is that we use opioid settlement money to support direct client needs for people who are transitioning out of our jail. So we're looking at ways that we can support them to be self-sufficient in the community, and some of those small direct supports to those individuals really helps to turn a corner and make them be successful outside of the jail setting. So just wanted to share a little bit more about Reset. And then I'm going to hand this off to Reed.
I just, seeing that nobody else wanted to talk, I love to talk, so I just thought I'd grab the mic. No, I just to kind of set off the something that I just want to mention that was kind of, I think, evident in the presentations that were given today is that, Beltrami County and Bemidji, both are really high needs. We are a high needs community. We have a lot of people in need. And most of the organizations and agencies that are set up to help people with those needs are understaffed, under-resourced, and overburdened. And kind of one of the beauties of living in that sort of a climate is that it forces collaboration between organizations. I mean, we would not be able to be the successes that all of our individual organizations and agencies are if it wasn't for the collaboration. Our day center is a real testament to that, where we have people from Sanford Behavioral Health coming over, people from VASH, the VA, from Support Within Reach, Face It Together, County Adult Services, and I'm forgetting probably a half a dozen other CRC, Stellar Human Services, all come through, and we all work together. And it's that kind of collaboration and I guess synergy, which is a word I don't like to use, but it's true in this situation. We are really able to tackle these kind of huge challenges. Jeff was talking about how important it is to have the right person in a job, because so much of the work that we do is relationship based and it's trust based, and it takes a while to build up trust, and it doesn't take very long to lose it. We had a wonderful person from Sanford Behavioral Health that was officing probably 12 hours or more a week at our place. She was just a rock star. Everybody loved her, trusted her, and then she moved on to better opportunities. And so now we're waiting for that position to be refilled by Sanford, and it will take, from when that first day they show up, it's going to take 2 months, 3 months to rebuild that trust, and so that's just what I wanted to say. I mean, we do a great job in this community of working with each other. I know in larger communities, organizations might fight over caseloads because they want those billable hours or whatever. Here we don't have that problem. Everybody's got cases to spare, and so we're able to collaborate in really great ways. So that's all.
Thank you, Reed.
I think if I were to draw an exercise, like if we were a committee, right, and we were doing an exercise right now on putting sticky notes up on the wall saying, okay, what are the common themes that you heard in the presentations? I definitely would have said giving people hope, but definitely the connection that we have among all of our community partners. And I think that's something that has been really important to the Opiate Steering Committee. And in fact, in the booklet that you got, this is the CHA-CHIP, so it stands for Community Health Assessment and Community Health Improvement Plan. And so throughout that book, we really tried to showcase as a community health board how our community is connected, because so often we hear about all of the negative data, the negative statistics, and how we're the worst at this. But we have to remember, think about the great things that we're doing in our community. And so we did try to showcase that through the CHA-CHIP, through putting photographs in there that people can connect to. But then when we built the improvement plan section, so when you're in the back of the book and you're looking at the CHIP, which is on 22 and 23, you're going to see the same activities that we talked about here tonight embedded into those plans, because we believe in them, because they're important to the success of our community, and because it connects our community. And that's one thing that I think, as Jeremy and Jennifer were traveling with us today at the different meetings, they heard over and over again is, of all the things that we can say that we're not doing well, we do really well at connecting. When a storm hit, people picked up the pieces and they said, okay, how can I help my neighbors, right? When we had the resource center running, people were in, and how can I volunteer? I wasn't damaged, but how can I support? And I think that the opioid committee is seeing some of that same successes because of that community connection. What other questions, comments, concerns?
I'm not gonna pick on you. Taking off my like Beltrami County employee hat for a second and putting on my community member hat for a moment. I just want to encourage the steering committee to continue to look for ways to normalize sobriety. because we so often focus on the brokenness of people and the trauma and what is wrong, and instead of what is right, what is going well, and what people can do something about. So I just want to remind people that, it comes back to that hope message, that when people are struggling, and the majority of my career has been working with individuals that have substance use or high risk, lifestyles, and on a personal basis too. I have family members and whatnot, and I can just tell you that if I go at them and I just tell them what is wrong all of the time, and I don't give them an avenue to see what is right, it's real hard to dig out of that. So that's all I wanted to say.
Hi, I'm Kim Graham, and I'm the director over at Basque. And I wanted to kind of play off of what the girls were saying. We did start another youth advisory program at the middle school, and that's called Uplift. So the Uplift is the junior program before they get to the high school, the Rise Above. And so that's just in the process of being started. They're doing interviews, I think, next week for all the kids that wanted to join, because there's a limited amount of people, but wanted people to know that 7th graders. Yep. Uplift.
Yep.
I was wondering if you could share a little bit more about how Sanford Health is integrating peers in their work.
Totally you'd have to talk.
Thank you. We're similar, I would say, probably to Stellar. We have a peer support that we have embedded in our program. He's also, the hard thing with peer support is there's some limitations with billing. And so that's one of the things that I'd say, like, peer supports can't build groups, which is unfortunate because peer supports are amazing at groups. Peer support can't generally build transportation miles. That's another thing that they do a lot of. So generally speaking, when it comes to peer support, we end up having to put them under some kind of a grant program. So currently our peer support is under our New Beginnings grant, which is where we work with the Reset program in Beltrami County Jail. We do outpatient treatment in Beltrami County Jail. So our peer support is attached kind of to that grant. Unfortunately, that grant's ending in January, so we're gonna try, we'll find a way to, continue to sustain that. The other way that we've used peer support has been with our cultural advisor. So we actually have Joe, who is the peer support, has been a part of our Wellbriety program and doing a lot of that cultural connections. And then we also have another gal, Vicki Finday, who's a cultural advisor. So she puts on a community sweat every month. We actually work with Reed at the day center to do that. So it's Friday, you guys, go this Friday because the 31st is Halloween. So that's a shameless plug there. How do you like that? But yeah, so I mean, that's the way that we've utilized them. Fortunately, I think Sanford really sees the value in the work that we do, and so does really support us beyond what we probably could sustain if we were standalone. So they really have invested, especially, like I said, part of our cultural programming would be a big portion of what Sanford has supported.
I've just, over the several years I've been at Stellar, and I'm fairly new to the Bemidji community, so I can claim that. I wish I knew more than I did particularly about housing programs. And thanks to everybody that work on that. And it's just something that we've noticed over the years is it's really tough to work on your mental health and things like that when you're struggling with housing. So I would just say we'd like to be part of the solution. If anybody wants to partner, we'd be happy to do that.
Any other questions or comments from the community? Any comments from our commissioners? We appreciate your attendance tonight. Commissioner Sumner? He is our commissioner that sits on our committee, so.
Oh, I need a mic, but I guess. Well, welcome, everybody. Thanks for coming. I know it's been a long day. What time is it? All right. Well, if you don't know, I'm a man of few words, so I'll keep it simple. No, I was kidding. No, but thanks, everybody, for coming. I am the board representative, county board representative on the steering committee, and I just want to express my appreciation to, everybody that's involved, because this isn't, an issue that that's a political issue. It doesn't discriminate, I mean, we all know somebody, and I think we all trying to figure out how we can best, address the issue. And I think it takes a community, and, without the support of the county board, my colleagues, without, Amy and Ann and, my fellow committee members, this whole process is interesting. Going through the RFPs, it's difficult. It really is, because there's a lot of good projects, that people submit. But the unfortunate thing is we don't have enough money. But it's great to hear that, our community partners are working together, collaborating. I think that brings, me and my thoughts of not being able to help, it helps me, knowing that you guys are working together, because, when we go through the process, or when I go through, reading that, it's like, well, I want to fund this, but it might take away from this and things like that. And I'm just proud of the work that you guys are doing, and seeing the youth involved, brings me hope. Hope is kind of an inspiring word. At the beginning of this year, at the Association of Minnesota Counties Board, which I'm a member of, they asked us, what if 2025, just, if there's one word in 2025 that you want to describe, what would it be? Believe it or not, my word was hope. I have a lot of hope. And I think I'm glad that I stayed, this evening. I have a couple other meetings, but, I'm glad I stayed, because, listening to you guys and the work that you guys do, I mean, it's just, it's incredible. And my job as a commissioner is a lot easier than, the work that you guys do day in and day out. So I guess I'm a man of many words. No, I was kidding. But thank you. I'm going to put my other colleagues on the spot here, so if I have to, they have to.
Well, I guess I'll just say I'm pretty impressed with hearing all the different stories tonight and how everybody's working together, how it all clicks, on the BASC committee there, and I hear what they do, and I'm really impressed with the job that they're doing with the youth in the area, and to hear all the rest of the things, it's really it's good to know that the money that is being put out there is going to good use. So.
I really appreciate everybody being here tonight. It's great to hear from all the different organizations that are benefiting and helping. It's great to see our youth involved, and that just the program that I really am so impressed with was spoken to. I wish Amanda was here tonight to take a bow, because she just does such an awesome job with the Reset program, and we're very fortunate. We wish we could clone her. So thank you, everybody.
If I have to, I guess. No, thanks for everybody. I appreciate the collaboration that all the community members put into this. But I think the thing that I really want to focus on, as much as I appreciate all the community collaboration, we just have such a fabulous county team. Ann Linseth is our director, Jeff, and Amy. I can't speak highly enough of all of our county employees that work in that division. I'm overwhelmed sometimes at the work that you guys do. And I want you to know how much we all, as commissioners, appreciate everything you do. Thank you.
Thank you so much, commissioners. Speak.
Good evening, everybody. My name is Bedell Durano. I'm our state representative in our area here. And I just want to let you guys know that I support the work that's going on here. And if there's any way that I can help on the state level, that I'm more than willing to work with anybody inside this room and outside this room to make sure that we're successful in our area. So thank you very much.
We appreciate that so much.
Before I close our meeting, any last comments? Otherwise, I'll ask Anne for closing remarks, and then I just have a final thank you.
I just want to express my appreciation for everyone who is here tonight. Our steering committee has done tremendous work to try to get these dollars out into the community to be effective and to make an impact now. And so I appreciate the community involvement. I appreciate our community providers. And I agree with what Reed said about how sometimes we think that we live in a community that is resource poor. And in some ways, we do have challenges with resources. But one thing we do really well, better than what I have seen in other areas, is collaborate. We work together, we talk about challenges, and then we find creative solutions. And this is a testament to that. In fact, we were recognized by the state with the expenditures related to our opioid settlement dollars and getting them out into the community. So I'm just really thankful and humbled with the work that has been done in our community. Thank you all.
Yeah, thank you. All right, so one last gratitude. So this young lady sitting behind us, behind the computer, her name is Diane Moe. And without her help, we would not be able to put our videos on YouTube. We would not have our website because quite frankly, I don't know how to do program coding stuff in the background, and I don't have the time to do that. And so I give the stuff to Diane and I say, can you make this look pretty? And then she says, does this look pretty? And I said, this looks great. This is way better than I could do it. So could you just join me in thanking Diane? And she likes hugs. Thank you, everybody, for coming tonight, and don't hesitate to reach out. We do have all of my contact information and our steering committee contact information on our website.